Hello, welcome to today's webinar. We're so glad you could join us. My name's Emily Haynes, the Director of Public Health Initiatives at the Partnership for Maternal and Child Health of Northern New Jersey, which is providing today's program. Just a few pieces of information before we get started. An hour after the webinar ends, you will receive an email with a link to a post-program evaluation. Please complete the survey to provide us feedback on the program. In order to receive a certificate of completion, you must listen to the entire webinar and complete the evaluation survey. Certificates of completion will be sent via email within 1 week of the webinar broadcast. This program is being recorded and will be available on the Partnership's YouTube channel. We will be muting all attendees' phones during the presentation, but we would love to hear from you. Please write questions in the question box, and the speakers will respond to as many as possible at the conclusion of the presentation. I'm now going to introduce Dr. Joseph Schwab, Associate Professor of Pediatrics at Rutgers, New Jersey Medical School, and the Chair of our Essex Metro Immunization Coalition, to say some welcoming remarks before we introduce our speakers for today's meeting. Dr. Schwab?
Okay, thanks, Emily. I'm Dr. Schwab, and I'd like to welcome everybody today to today's EMIC meeting, especially those whose first time joining us. I'd like to offer a special welcome and to invite you to become members of our coalition. We will be holding a brief business portion of the meeting following the online presentation. That will take place from 1:30 to 2 after the talk. And that will provide some updates on our coalition's work and also on our upcoming projects. So if anyone would like to, please stay and join us for that part of the meeting. I'd also like to take a moment to thank and acknowledge all of our coalition members who have been working on the front lines of the pandemic, fighting this deadly virus here in New Jersey, which continues to have a tremendous impact in our region. We've been thinking especially of our friends and neighbors who are coping with the coronavirus in our region, and anyone who's been diagnosed with the disease or who has lost a loved one to the disease. You're in our thoughts and in our prayers. With the COVID-19 pandemic, we've seen a dramatic decrease in the rates of childhood immunizations, and so our work as in community engagement is more important than ever. As we serve as a vital resource for vaccines in Essex County and in New Jersey. So today's presentation, which has its topic on meningitis B vaccine, highlights one of the vaccines that's very important, but there's still a need for educating the public on its need and on this important preventable disease. And so I'd like to invite Emily now to introduce our speakers, and we look forward to the presentation. Thanks.
Thank you, Dr. Schwab. Our speakers today are Alicia Stillman and Patti Wukovits from the Meningitis B Action Project. Alicia Stillman is a meningitis advocate who lost her 19-year-old daughter, Emily, to meningitis B in 2013. She has since started the Emily Stillman Foundation to improve awareness of meningococcal disease, the vaccines available to help prevent it, as well as to encourage organ and tissue donation. Alicia lives with her husband in West Bloomfield, Michigan, where she is the CFO of a multi-state law firm. In addition to Emily, she has 2 children, Carly and Zach. She holds an MBA from Arizona State University and is currently completing a Master of Public Health at George Washington University School of Public Health in Washington, D.C. Patti Wukovits is a registered nurse and meningitis advocate who lost her 17-year-old daughter, Kimberly, to meningitis B in 2012. After her daughter's passing, she started the Kimberly Coffee Foundation to improve awareness of meningococcal disease and the vaccines available to prevent it. Her foundation has recently partnered with the Emily Stillman Foundation to launch the Meningitis B Action Project, a nationwide disease awareness and advocacy initiative. Patti lives in Massapequa Park, New York, with her husband, John. In addition to Kimberly, she has 3 children, son Chris, stepson John, and stepdaughter Jacqueline. Patti holds a Bachelor of Science degree in nursing from Chamberlain University. And thank you so much, Patti and Alicia, for presenting today.
Hi, good afternoon. I'm Patti Wukovits from the Kimberly Coffee Foundation. We have Alicia and I both from the Kimberly Coffee Foundation and the Emily Stillman Foundation. We both have received educational grants from Pfizer and GSK, specifically for the Meningitis B Action Project, which is a combined initiative of both of our foundations. There is no commercial support for this webinar, and program content has been reviewed by a content reviewer and found to be without bias. To receive contact hours for this continuing ed program, the registrant must sign into the program, attend the entire presentation, and complete and submit an evaluation. A certificate of completion will be sent as an email attachment within 1 week of the program. This program is being recorded and will be available as an on-demand education program accessed via the partnership's website until June 2nd, 2022. I would like to tell you my daughter Kim's story of meningitis B, but first I want to tell you a little bit about who Kim really was. When she was a little girl, I remember her with these cute little freckles sprinkled across her nose, and sometimes at night when I was putting her to bed, we'd try to count them. And then they just got to be too many, so we had to stop. But we had, we always had these, as parents do, we always had these silly little games we used to play with each other. That was one of them, one of the many. Kim was full of life. She loved to sing. I dubbed her as the karaoke kid. If there was a mic, she was at it. I still have her American Idol karaoke machine, and I know I'm going to keep that one forever. She had a really beautiful voice. She was really an excellent singer. She was an excellent dancer. She started dancing at the age of 3 years old, all the way into her mid-teenage years, and she performed in a lot of school and community plays. Whether she was in the lead or in the background, you knew Kim was in that show. She made herself known. She was really silly with a contagious laugh. She was very, very smart and very mature for a 17-year-old. In this picture, she was actually 16. But Kim's absolute favorite thing in life was to be at the beach. We live in New York, we live on Long Island, and we're very close to the ocean. So, we would be at the beach constantly. So when she was little, we would build little sand castles. When she was older, the best thing in the world for her was to be at the beach with her friends, to be swimming in the ocean and then just laying in the sun and just having the time of her life. So, Kim at 17 years old knew what she wanted to do. Her dream was to be a pediatric nurse. She wanted to follow in my footsteps as a registered nurse. And she had been accepted into a nursing program on Long Island. And I always say, what 17-year-old really knows what they want to do? Not too many. And I like to sum up who Kim is with just 3 words: life, joy, and love. So as far as Kim's story of meningitis B, Kim was a high school senior. She was 17 years old. She was in her last 2 weeks of school, looking forward to prom and graduation, looking forward to taking her, her New York State Regents and all her finals and all of that, and moving on to become a nurse. However, she came home from school one afternoon with a fever of 101 and body aches, and I gave her Motrin. I called the pediatrician, and he suggested to give her the Motrin, see how she does throughout the night, and if she's not better, bring her in the morning. She may have the flu. It's what the symptoms presented as: body aches and a temperature of 101. After the Motrin, she was fine. She was skipping around the house. She was her normal little self and just being herself. However, by the morning when we woke up, she was in really bad shape. She was complaining of a lot of pain. She complained to me that, "Mommy, everything hurts me from my eyelashes all the way down to my toes." And she could barely get out of bed. And she said, "Mom, it's really weird, but I feel like my ankles are bleeding." So I looked at her ankles, and on one of her ankles, she had 3 tiny purple dots. She had 3 tiny petechiae, which I saw actually then increase into a rash that very slowly creeped up her body. I rushed her to the emergency room, and on that 10-minute ride to the emergency room, she really went downhill very quickly. When I got her to the ER, they knew what she had just by her presentation, because she had this rash and the other symptoms that she had. So immediately they drew blood cultures and started IV antibiotics and got Kim into isolation. And all of the doctors converged with, to us, and they were asking Kimberly and I multiple questions. Being that they knew it was meningitis, I didn't know yet, but they were asking, obviously, for contact reasons. Who were you with? Where had you been in the last, 3 to 4 days, and that type of thing. And she was able to tell them, although she was in pain, she was able to tell them. The doctor pulled me aside separately, and she said to me that we believe that your daughter has bacterial meningitis, and we believe that the bacteria have infected her blood. And I told the doctor that Kimberly cannot possibly have bacterial meningitis because I made sure she was vaccinated with the meningitis vaccine. However, the doctor went on to explain to me that the meningitis vaccine, the MenACWY vaccine, which Kim and so many others have received, only protects against 4 of the 5 serogroups, and there is a 5th serogroup called serogroup B, and that we do not have a vaccine for it. Now remember, this was in 2012. So my head was spinning. I had no idea what was going on, but I knew I needed to focus on Kim. So she was brought up into the ICU, and very quickly she was in multi-organ failure. She went into cardiac arrest, and they were able to resuscitate her. Over the next few days, we did see this purplish rash go up her body. She was completely purple, so much so that then, because all of the oxygen was going to her vital organs, she was losing blood flow to her extremities, and her extremities went from bright purple to black. And the doctors had told me if Kimberly had survived this, she would likely have been a quadruple amputee. So Kimberly ended up being in the hospital for 9 days, and throughout her hospitalization, I had to be in touch with my son Chris, who was in Army boot camp in Oklahoma, and he wasn't allowed to have access to a phone. So every day I had to have the pediatric intensivist. I was lucky that Kim was admitted to the PICU because she was 17, and she was actually the only person there, which was great. Either way, she got excellent care. But the pediatric intensivist had to call the Red Cross every day, and then the Red Cross had to call the Army, and then the Army had to get my son Chris on the phone. And that's how I spoke to him every day. And every day he would say, "Mom, do I need to come home? Do I need to come home?" And I would say to him, "No," because at this point, this went on gradually, but at this point in time, every day when I spoke with him, I said, "No, I think she's actually going to turn the corner. We think she might do well because she still has brain activity." So as the days went on, it became apparent that Kim actually was going to have brain herniation. She had impending brain herniation, and the doctors prepared me for the worst. And I had to call my son then and tell him he did have to come home, and he would have to come home to say goodbye to his little sister. So we waited for him to get back to the hospital. We were all with her, and we took her off of life support. And of course, it was the most horrible decision I had to make in my entire life. So there was not a meningitis B vaccine available for Kim then. There is now, and that is why I have created the Kimberly Coffee Foundation. Through the Kimberly Coffee Foundation, I educate throughout the country. I educate locally. I speak at medical conferences, do webinars such as this, and educate the community. We also, through the Kimberly Coffee Foundation, have a nursing scholarship, which is the Kimberly Coffee Memorial Nursing Scholarship. And one of the requirements that I have is that the applicant must include documentation showing that they have been vaccinated with both the MenACWY and the MenB vaccine. Right now, just yesterday, I received all the applications from her high school. And I can't wait to actually start looking through them, because each year it's so amazing to look through them and to see what the kids have to say about Kim and why they feel that they're deserving of this scholarship. And it's really exciting. And sometimes I have a hard time deciding on one kid. You know, the board of the Kimberly Coffee Foundation votes, and sometimes we actually end up giving out 2 scholarships. So we'll see how that's going to play out this year. And then through the Kimberly Coffee Foundation, we have joined the Emily Stillman Foundation, and we now have this joint initiative called the Meningitis B Action Project. And I'll give it to Alicia next, and she will talk about her daughter, Emily. Thank you.
Hello, my name is Alicia Stillman, and I am here with you today. I am in Michigan, where I live, and this is my daughter, Emily. And Emily was my middle daughter. She was a sophomore at Kalamazoo College, which is a small liberal arts college in Michigan. I always laugh when Patti and I present together, because Patti's daughter knew, from an early age that she wanted to help people and be a pediatric nurse. And I always say, well, my daughter would be waiting tables, because Emily's dream was to be on Saturday Night Live. The truth of the matter is, she was very funny. She was extremely talented. And there's a very good possibility she may just be on Saturday Night Live. But my husband and I told her she had to have a plan B, and that was psychology. So I always laugh when Patti and I present together, because I say, oh yes, your daughter would be saving lives and mine would be waiting tables. But Emily was funny. Emily was everybody's friend. When Emily smiled, the sides of her mouth didn't just turn up into a smile. Emily smiled, her whole face lit up. And to this day, I don't think that Emily ever realized people are different colors or different religions or had different beliefs in any way. To Emily, Emily just looked at people, and it was always so refreshing. She was never a part of a clique in high school. Emily was friends with people from all cliques. Emily was just everybody's friend. And I always found that to be just so refreshing about her. When Emily was a sophomore in Kalamazoo College, they were required to live in a dormitory environment for the first 2 years. And the second year, she lived in a suite with 4 other people, two boys and 2 girls and her. And she called home one night. She said, "Mom, I have a headache. I have that achy feeling." And I thought, maybe she's coming down with the flu. And she said, "No." She says, "You know that feeling I get when I get overtired?" She said, "Last night I was up all night studying for a couple really, really big tests. But don't worry, Mommy, I did really good on those tests." And I said, "Great." She says, "But I have that feeling like when I don't get enough sleep." And it was 10:15 at night. And I said to her, "Why don't you take some Motrin and go to sleep, and we will see how you feel in the morning." And that was the last time I ever heard my daughter's voice. She went to sleep, I went to sleep, and I never heard again until the morning. But the story goes, she woke up a few hours later, somewhere around midnight, and she said to her suite mates, "My head really hurts. It's not feeling better, and it hurts worse than it ever hurt before, and different. Maybe I should go to the hospital." And they took her to the hospital. Nobody called me because Emily was 19 years old, and Emily walked into the hospital. She wasn't planning to die. Emily walked into the hospital with her backpack, her iPad, her phone, her computer. I even found a textbook there in her backpack. She maybe was going to study. She walked into the hospital. And because she presented with simply a headache, no other symptoms, she was treated for a migraine. Again, I wasn't called until the next morning, but the next morning they contacted me and they said, your daughter is quite sick. We believe she has bacterial meningitis. We understand you live several hours away, but you should get to the hospital right away. I was really confused because I didn't think my daughter could have bacterial meningitis, because I remembered that Emily, before she left for college, her freshman year, had been vaccinated for bacterial meningitis. And I think the only reason I really remembered, I have no medical background. My background was accounting. And the only reason I think I remembered was that her year was the year that the recommendation for the MenACWY vaccine changed to require a second dose. Before her year, they gave it to the kids at age 11, and there was no booster dose. For Emily's year, before she left for college, her class was the first one that was required to get the booster dose. So it kind of was fresh in my mind. But nonetheless, I got en route and I started to drive. But the first call I did make was to her pediatrician's office. And I said, this is Alicia Stillman. I'm on my way to the hospital. They tell me Emily could have bacterial meningitis. I don't think that that's possible, is it? Because she had the meningitis shot. They pulled her chart. Remember, this was 2013. There was no MenB vaccine, not that I had heard of it anyway. They said, yes, she had the meningitis shot before she left for college. Keep us posted. I went alone because I don't think that it even dawned on me how serious that this could be. I had no idea how my life was about to change. My husband was away on business. I have a daughter 1 year older than Emily. She was doing an abroad program in South America. And I had a son still in high school, and he was in school. But I started my drive. I got to the hospital and I walked in and I said, hi, I'm Alicia Stillman. I'm Emily's mom, not knowing what to expect when I got there. Emily had already lost consciousness. She was already intubated. They were preparing Emily for a craniotomy. They told me that the swelling in Emily's brain was so severe that if she were to survive this, they wanted to try to lessen the degree of brain damage that she would be left with by doing a craniotomy. They asked me at that point, which I'll never forget, if I wanted them to call clergy. At that point, I called my husband out of town and I said, oh my God, this is really bad. And at that point, I remember wondering, do I call my other daughter home from South America? I didn't even know how to handle it. Everything was just happening so quickly. Emily survived the craniotomy, but she never regained any brain function. The swelling had been so severe that the swelling in her brain never went down. By the next day, my husband was already back. He had come home. During her surgery, I had called my daughter, my older daughter, home from South America. They had told me anybody who would want to be there with her should come and be with her. And we were all there, and they told us that Emily had no brain function. Most likely from the time that she lost consciousness. They said she probably didn't have brain function at that time. I made the decision along with my husband to have Emily become a hero. She donated 6 of her organs to 5 people. And she saved all those lives and many more with bone and tissue. When I said goodbye to my daughter laying in that hospital bed, there were tubes everywhere, all these things flickering. I remember lights flickering, I remember tubes, and I remember noises, beeps. And I said, you go and be at peace. And I will be okay. I promise you, I'll be okay. And I'm going to figure out what happened. I'm going to try to figure out how this could have happened to you because it was my job as a mother to protect you. What did I do wrong? And when I figure this out, I will be your voice. And I will make sure that this doesn't happen to other families. And then I said goodbye. And I remember those first few weeks, even into months, I remember that feeling always, why me? And how could this happen to me? And how could this be our family and my daughter? And how could this have happened? And the more I learned, the more I realized and that this is not me and this is not our family. This could be anybody, and it's because it's me. And at that point, I created the Emily Stillman Foundation. For us, our first order of business was, we live in Michigan, which is right across the border from Canada, and Canada had this vaccine that was not yet licensed in the United States. And this was right around the time of the Princeton outbreaks, and they were bringing in this not yet license to protect the people, the kids on other campuses, on the campus at Princeton, on the campus at UC Santa Barbara. I still had a son that was getting ready to go to the University of Michigan. I still had a daughter that was going to be, my older daughter that was going to be going back to the University of Michigan to finish her senior year. And I knew I needed to get them protected. So I started to charter buses and take whole families across the border into Canada to receive this vaccine. And this is actually where Patti and I got vaccinated with the MenB vaccine too, on a day that I'll never forget. So the Emily Stillman Foundation was created at that time. It was created to raise awareness for meningococcal disease. That has changed to all vaccine preventable diseases. I've become a very strong vaccine advocate for all vaccines. And we also raise awareness for organ and tissue donation. In 2016, we added the third of our trifold mission, and that is global health and awareness around the world to make sure that everybody has access to vaccines and the same protection that my daughter should have had. And in 2017, we partnered with the Kimberly Coffee Foundation to create this joint initiative, the Meningitis B Action Project, and that has become the meningitis, the educational arm where we educate around the country. Well, it's actually around the world because we even have presented outside the country. And that is what we're presenting to you here today. Patti?
So again, Alicia and I, like many parents, we thought that our girls were protected. They got the MenACWY meningitis vaccine at 11 and 12, and then the booster at 16. And we thought they were good, but they weren't. And as Alicia mentioned, the MenB vaccine was not available at that time in the United States to help protect them. So Kim died in 2012 and Emily died in 2016, and MenB vaccination became available in the US in 2014. So our message is that it is available today, and that is why we do what we do, to make sure this does not happen to any other families. But they can't know about the meningitis B vaccine if, they can't know to ask about the meningitis B vaccine if they don't even know about it. So that's where we come in and we educate healthcare professionals, healthcare providers, as well as the public, parents. So a little bit about meningitis B. It's meningococcal disease. So meningococcal meningitis is the most common form of bacterial meningitis in adolescents and young adults. And it's mainly caused by 5 types or 5 serotypes of meningococcal bacteria: A, B, C, W, and Y. Meningococcal bacteria can cause a life-threatening bloodstream infection, sepsis, which is what Kimberly had, meningococcemia, or it can present as meningitis, an infection of the lining of the brain, which is what Emily had, or it can actually present together. They can present together. So the way that the disease is transmitted, it's very easy to spread. Now, the ages of 16 to 23 are at very high risk. And the reason being is that they share saliva, as we mentioned, as you saw in our video when we started the presentation. So it's spread through kissing, it's spread through sharing e-cigs and vapes, anything that comes into contact with saliva, whether it's sharing food, sharing a chapstick, sharing a drink. And then, of course, being in close quarters, being sneezed or coughed upon. And it can attack without warning, and the symptoms include a high fever. It can be a stiff neck, vomiting, severe headache, severe exhaustion, or a purplish rash. And none of these symptoms, it doesn't have to be all of these symptoms. It can be one or, just a combination of any of these symptoms. This disease can kill in a matter of hours, and 1 in 10 will die. 2 in 10 will face permanent complications such as limb loss or brain damage. This disease can kill a healthy person within 24 hours. So why does meningitis B vaccination matter? So as we've mentioned, our girls were not vaccinated with the MenB vaccine. So now, if a person has not received both the MenB vaccine and the MenACWY vaccine, they are not fully immunized against meningococcal meningitis. So we have this graphic which shows that more have received the MenACWY vaccine, the common quote-unquote meningitis vaccine, with the first dose given at 11 to 12 years old, with a very, very important booster dose given at 16 years old. Then we have the MenB vaccine available as of 2014, which very few, unfortunately, have received. The first dose is given at 16 to 23-year-olds, and depending on the brand, the second dose is given according to the schedule. Now, at the 16-year-old booster dose visit, that is when they can also start the MenB vaccine series. So they can get their booster dose in one arm for the MenACWY vaccine, and they can get their first of the MenB vaccine series at that same visit in the other arm. So as I mentioned, these are the brand names of the vaccines. One became available in 2014, which is Pfizer's, and then Bexsero, which is GSK's meningitis B vaccine, became available in January of 2015. Too late for our daughters, unfortunately. The reason why the MenB vaccine is different and can't be combined into the ACWY vaccine is because serogroup B requires a different and a separate vaccine because of the way that it attacks the bacterium. So the MenB vaccines have FDA approval. They can be used for the age groups of 10 to 25. However, when you start one MenB vaccine series, you cannot interchange with the other for the second dose. So if you start with Pfizer's TrueMember, you must continue with that when they go to complete the series, and vice versa. There is no interchanging of the MenB vaccines. The second dose must be completed for TrueMember within 6 months of the first dose, and for Bexsero, and at least 1 month after the first dose. And now we'll put up our poll about the ACIP meningitis B guidelines. Okay, am I back in? Can you hear me? Do I advance?
This is just the results of the poll, so you can comment on
Yes.
that, and then we'll undo it.
Great, great. So I'm happy to see that 68% have chosen the correct answer, that MenB is subject to shared clinical decision making. And I'll go to the next slide. So the ACIP guidelines are this. As I mentioned earlier, 11 to 12-year-olds receive the first dose of the MenACWY vaccine and then the booster dose at 16. The MenB vaccine can be given at 16 to 23-year-olds. So why does the CDC advise that 11 to 12-year-olds should receive the MenACWY vaccine, and that for 16 to 23-year-olds, they may receive the MenB vaccine? And those two very small words, should versus may, are actually causing quite a bit of confusion amongst the medical community, amongst parents, and amongst students. And the reason for the difference in the vaccine recommendations is that given that it's a newer vaccine, at the time of ACIP's review of the MenB vaccine in 2015, there was not enough evidence on duration of protection, effects on carriage, effects on herd immunity, and strain coverage. And in addition, the following factors have also been cited: that MenB has a lower incidence of disease and there's a high cost of routine vaccination. Many physicians are not talking to their patients about the MenB vaccine. According to a study in pediatrics in 2018, among 900 doctors that were surveyed, 49% of pediatricians and 69% of family physicians did not discuss the MenB vaccine during their routine visits for the 16 to 18-year-olds. So, through the Meningitis B Action Project, we conducted an anonymous web-based survey of healthcare providers. We wanted to find out, and we wanted to get a better understanding as to why some may or may not be discussing the MenB vaccine with their patients, and why some patients might decide to decline the MenB vaccine. So, as you can see, the most common reason why providers did not discuss the MenB vaccine with some or all of their 16 to 23-year-old patients is because it's not required by schools and colleges of their patients. The reasons given by patients and their parents for declining the MenB vaccine, according to the providers, is again because it's not required by schools and colleges. And you can see the rest of the results, but the college theme and the message that it's not a requirement at colleges is really what is really driving a major decision here for these physicians. And this is our second poll.
We want everybody to respond. We want to see what your thoughts are on this. We'll give it a few seconds before we close. Looks like most people thought it was 5%.
Okay, Alicia, I'll leave this up to you and give you the next slide.
So the poll question, what % of colleges and universities in New Jersey do you think require the MenB vaccine? Actually, the correct answer is 0%. Out of 90 colleges and universities, 0% require it. And in light of the fact that that is the reason that the providers, the largest reason that the providers don't talk about it, and the largest reason that the patient does not take it, is because the colleges, this is quite concerning to us. Next slide, Patty. So this is our website, the Meningitis B Action Project website, and there is a map that you can see that will describe the purple as schools that are requiring the vaccine. The red is schools that have past cases. It's very comprehensive. It's very, I think, surprising, and it shows us really how much work we still have to do. MenB outbreaks on college campuses are very hard to control, and they have multi-level medical, economic, and reputational implication. 32 colleges and universities have had MenB cases between 2008 and May of 2020. 42% of colleges and universities have had to deal with a MenB outbreak. Less than 60% have estimated one dose coverage following the initial mass vaccination efforts at 6 large universities, with even lower coverage for the final second or third dose. And a very interesting statistic is it took 23 months for Ohio University between January 2008 and November 2010 to get control of their MenB outbreak. Outbreaks are disastrous for a university. They affect every single part of the university, and that's what we try to explain. And I'll come back to a current initiative we have going on right now involving colleges towards the end of my presentation. %80 of the parents don't even know about the meningitis B vaccine, according to a recent study. 70% of all meningococcal cases in the United States are among 16 to 23-year-olds. 100% of the college outbreaks since 2011 are caused by MenB. And to me, this is especially interesting because many colleges, not all, require the MenACWY vaccine, but still don't require the MenB vaccine. 83% of the 16 to 18-year-olds have not received at least one dose of the MenB vaccine. But yet we know that students are 5 times more likely to get MenB than a non-college student. So the Meningitis B Action Project was created to help close the meningitis B awareness and vaccination gap. So what do, Patti and I? Well, we raise awareness. We let people know that there is such thing as MenB. And the studies show so many people still don't know. We empower young adults with the proper information to talk to their healthcare provider about meningitis B and the vaccine that can help prevent it. We encourage healthcare providers to discuss meningitis B and the MenB vaccine with their patients. We increase awareness of meningitis B on high school, colleges, and university campuses. We also engage with policymakers to facilitate broader access to the meningitis B vaccine. This is not a mistake that this slide is in here a second time. If you have no other takeaway today except one slide, this is the one. There are 2 meningitis vaccines that are necessary to help protect against the disease. More have received the MenACWY vaccine, but few have received the MenB vaccine. Unless a student or a patient has received both, they are not completely protected from meningococcal disease. We have resources that we have developed that are available for free, that are, some of them are, you'll see, downloadable right from this webinar. Others you can go onto our website to access. But we have brochures available that are appropriate for the student themselves, the patient themselves. We also have them geared to the parents. We have one-pagers that are appropriate for healthcare providers. We have posters that can be put up in waiting rooms and in operatories. We have tear-off reminder pads. We have magnets. We have shareable social media graphics. We have several videos, one being the one that you saw at the beginning of today's presentation. Another is one that is animated. We speak all over the country. Unfortunately, now in today's environment, we're speaking more through webinars, but we are eager to share our stories. We know that there is nothing that we can do to bring back my Emily and Patty's Kimberly, but we also know that there are millions of other Emilys and millions of other Kimberlys out there, and to them, for them, and for their families, we can help protect them. So there are handouts available through this webinar today, but I encourage you to go onto our website and download anything else that you would like to receive. I'd also like to share with you that there is a Medscape modular that concentrates on MenB, and you can receive continuing education credits for that. Currently, we have a very strong initiative where we are asking people to sign on to our letters that we will be sending to college campuses around the country, to sign on by through providing a logo, to tell college campuses, you know, at the beginning it was uncertain whether they were going to reopen or have virtual classrooms. And we see now that one at a time they are reopening. I understand that they're reopening. I understand that they want to reopen. It's about dollars and cents. I understand that parents want their kids to have a true college experience. I understand that college students want a true college experience. So if we are sending those kids off to the wolves, so to speak, let's at least make sure that they have the most comprehensive, full and robust immunity possible. We know that their vaccines are not up to date. We know that 60 to 80% of kids are not up to date on their immune system coming off our COVID period. And we know that there is a possibility for a resurgence, and we need to protect them. And we would like all colleges to require all vaccines. So if you are interested in signing on, please email us your logo. Next slide. And these are some ways that you can work with us. You can help us to ensure that no other young life is unnecessarily lost to meningitis B. You can learn more on our website. You can talk to your friends and your family and your patients and make sure everybody knows about the MenB vaccine. You can help us by distributing educational materials. You can invite us to speak at local events. You can follow us on social media. And this is why we do what we do. These are people that we have lost or survivors of MenB. And the survivors are, as Patti described, had her daughter survived, she would have been a quadriplegic amputee. And the surviving ramifications are very severe, whether it's brain damage or loss of limbs or severe burning, scarring on their tissue. It is a very, very hideous disease. And I thank you for participating with us today and for being willing to let us share our stories and explain to you what we do and the importance of why we do it. And at this point, we'll open up for questions.
Thank you so much, Patti and Alicia, for sharing your stories and all of your expertise with meningitis B prevention. We can take questions in the question box. So if you have questions for the speakers, either Alicia or Patti, please go ahead and type those in. And let's take a look and see which questions we have in so far. Okay, so can either one of you talk a little bit about how you reach out to colleges about their meningitis B requirements, and are all colleges outreach, including historically Black colleges and universities?
So if there is a specific college that you have a connection with that we can reach out, please help us make a connection. We do the best we can with all colleges. We have tried to reach out to colleges across the country. This particular outreach is going to be via a letter. We do a lot of work through also ACIP, American College Health Systems. If anybody has any connection to any colleges, we would appreciate a contact and the assistance.
Okay. Another question is, why do you think Princeton and Rutgers do not require MenB after they had outbreaks?
That's a great question. I believe it all comes down to they still do not believe that this disease is as prevalent as it truly is. And it may come down to dollars and cents. And, you can't put the cost, you can never put a dollar amount on a person's life, never. So yeah, it's not great at all that they are not requiring it. Of course, in our opinion, we feel that they should.
Some colleges have actually responded to me that they're hesitant to add an additional vaccine requirement. And this is, of course, before COVID, because they're afraid that it might discourage a student from going there as opposed to someplace else. And as hard as that is to stomach, I've tried to negotiate about that. I think at this time, though, coming right off of the COVID surge, I think is our best opportunity to require as many as possible. I think we have a graphic that we're sending along with it that shows the difference between coronavirus symptoms as opposed to meningitis symptoms, as opposed to a common cold, as opposed to a flu. They're all dangerous in their own right, but meningitis is preventable. So let's prevent what we can at least, and then educate about the rest so they know what to look for. But these kids need the most robust immune system they can to participate. We are sending them off. We know they're not going to wear masks all the time. We know they're not going to socially distance. We know that their behavior puts them most at risk than any other age group to begin with. Let's protect them if we're sending them off. Almost like a coat of armor. Let's give them a coat of armor.
Another question is, are you working with ACIP to strengthen the recommendation for MenB to be universal, and is there any progress on that front?
Go ahead, Alicia.
You want me to take that one? Okay, we have tried. We will continue to try. both Patti and I have testified at ACIP with great big pictures of our daughters, and we will continue to do so. And we promise you that. But right now, I don't see that changing in the immediate future. We have been told that that is not going to change in the immediate future. So until it does, we need to work with the best possible scenario that we can. And that is by just making sure everybody is most aware and asks for it. And, you know.
Right. And if the healthcare provider is not bringing it up, we want to make sure that we're educating the parents and the students so that they know to ask for it if they don't bring it up, so that they have the information. And, you know, we always say that you can't ask for something that you don't know about. So it's really, it's a tricky situation. You know, first of all, parents should know about it. There's no reason why a healthcare provider should exclude any vaccine. It's their responsibility to tell their patients about all available vaccines, including the MenB vaccine.
Agree. You know, when our daughters died, you know, Patty's daughter in 2012 and my daughter 2013, and the vaccine wasn't available, so there was really nothing for the physician to have told us about. Unfortunately, the more recent deaths, it is still happening. And in at least two of the scenarios, we know the student patient had been to a pediatrician, received other vaccines, and the pediatrician did not inform the patient and the parent about the opportunity to get the MenB vaccine. And that, frankly, is unacceptable. You know, I find that just—
And they died. And they died.
And they died.
From MenB. Yeah. So they weren't informed, they didn't know about it, and therefore they couldn't protect their child. So one other thing I do want to bring up is, you know, we talk a lot about colleges. Just remember that this is not a college-only disease. You know, always remember that Kim was a high school senior and that Emily was in college, but it is just not a college-only disease.
So
Patti and Alicia, I have another question. We have a lot of questions coming in. They're all very good, and we'll get to as many as we can. One is, do college students over 24 years old need the vaccine?
I don't know. Is it up to the individual college? I don't know.
My opinion is, do they need the vaccine? My opinion is yes. You know, most college requirements will involve people who live on campus. So from the college, you know, standpoint, I don't know, and it would depend where they are. But do they need? Look, I had a daughter that I insisted she got it even after she graduated because she lived in Manhattan. She was on the subway. She went to workout rooms, you know, the exercise machines. And, you know, I believe she's still engaged in at-risk behavior. Just because she was done with college didn't stop her from sharing a drink or sharing a bottle of water, as unintelligent as that is. And so I wanted her to have that protection.
Okay, and one last question, and then we'll move on to the MNIC meeting, and we can make sure that any questions that were unanswered, we'll share those with the speakers so that they can address them after the presentation. Yes, a couple of people asked about the recently passed New Jersey law, which requires healthcare practitioners to discuss MenB vaccination. Do you think that this will help increase awareness and vaccination rates in New Jersey?
Absolutely. Absolutely.
Oh,
yeah. We're so happy about
I wish they would pass that around the country.
Yeah, it's fabulous. It really is. And, you know, and we supported that, and we really I mean, of course, the next best thing would be to require it, but to have that conversation and make sure they have that conversation, the vaccination rates will no doubt increase.
Okay, wonderful. So that's all the questions that we have time to answer today. Many thanks again to Patti and Alicia for a wonderful presentation. I learned so much today, and I appreciate you sharing your stories with
Can I
us.
say one more thing, Emily?
Oh, absolutely, yes.
I want to point out too, because I think I might have forgot, that we have our volunteers who work with us around the country is called our B team. They're really our A team, but you know, because meningitis B, they're our B team, and they are volunteers around the country. Some are students, some are parents, some are medical professionals. There are doctors and nurses and college people, and anyone who has just wanted to help us joins our B team. And to shoot us an email and say we want to join your B team, sometimes it involves sharing something on social media. Sometimes we need to help put up posters. Anything that anybody can do, we would welcome the help, and we would welcome an addition to our B team. Just shoot us an email and say you want to participate, and we'll keep you posted and in the loop. And send us your logo and tell us you want to work with us on this college initiative to help put this coat of armor on our kids. And thank you again.
Yes, please, please join us. Thank you.
Thank you so much. And this webinar is being recorded as well. So if you need to go back and look at the slides and rewatch, we'll have that posted on the partnership YouTube channel probably by the end of this week. So now I will move on to our business portion of the meeting for Dr. Schwab. Can you please move on to our minutes approval?
Thanks, Emily. So I'd like to offer my thanks as well to the speakers for a wonderful and very impactful presentation. And I hope, if you're still on the line, that we're very encouraged by what you're willing to share and provide in terms of information, but also in terms of your personal story. And hopefully you're encouraged by us to continue to do the good work that you're doing.
Thank you.
Thank you.
Thank you.
So we'll move on now to some of our updates. First, a matter of business. If you should have received, everyone, the minutes from our March meeting. They were sent out in the newsletter. And so for those of you who have had a chance to review them, if someone could make a motion to approve them, and we can take a vote over the chat to get that accomplished. And I think maybe we can let that happen in the background, and I'll invite Kendra next to provide updates on the work of the Community Education Working Group next.
Okay. So hi, everyone. For those who don't know me, my name is Kendra Julian. I am the Adolescent Immunization Specialist at the Partnership for Maternal and Child Health. And so today I will be giving you an overview about our Education Working Group. But before I do so, the purpose of the Education Working Group is to discuss immunization education opportunities and to discuss any future immunization education events. So on our call, we've been talking about preparing for flu season. The working group brainstormed ways on how to promote flu vaccine. The group suggested outreaching to grocery stores and pharmacies to share flu education materials from the CDC. I was able to outreach 20 pharmacies and 6 grocery stores in Essex County. I sent a flu poster and a flyer to the pharmacists and store managers. Each person that I spoke to mentioned that they will display the posters at their location and have the fact sheet available for the customers. So they were extremely interested in promoting, the flu information and promoting flu very early. And we've also discussed planning a health fair for the fall. But due to the uncertainties of COVID-19, the group, instead of canceling it, the group suggested hosting a virtual health fair. We discussed having different health topics that people can learn about, such as flu, hand hygiene, avoiding illnesses, COVID-19, and reminding people as we go into the fall to continue those healthy practices. We also would like to include other organizations to take part in this virtual health fair to share some resources that they have. And, if this is something that, you're interested in, you can definitely take part as we're planning for the health fair. You can let me or you can let Emily know. For those who don't know me, don't have my contact information, you can definitely send an email over to Emily. Then we also talked about, some virtual education. So once the pandemic happened, that kind of took away from us being able to go out and educate. And I know, especially for me, I do a lot of parent educations, a lot of education to the college students and high school students. So we had to come up with, I had to come up with a way to, still provide this information. And I worked closely with my colleague, Melinda Garcia. And what we did was we created 2 HPV home videos for middle and high school students as well as college students. And so the purpose of the video is to educate students about the importance of HPV and the vaccines. We were able to share the video to schools that we worked with in the past. Some of the partnership programs have also shared the video to other organizations and schools. And both of these videos can be found on our YouTube channel. Rutgers University in New Brunswick also shared it on their Twitter page. For our middle school video, we received about 66 views so far, and for our college video, received about 42 views on YouTube. We actually have the middle school and high school video today that we would like to share with you. So Emily, do you mind sharing that for me, please? Hi, my name is Kendra Julian.
And I'm Melinda Garcia.
And we are from the Partnership for Maternal and Child Health of Northern New Jersey. Today, we're going to give you a brief overview about HPV and the vaccine. So let's begin. HPV stands for the human papillomavirus. It's the most common sexually transmitted disease. About 14 million people, including teens, become infected with HPV each year.
HPV can cause cervical, vaginal, vulvar, and mouth and throat cancer in women, and anal, penile, and mouth and throat cancer among men.
HPV is transmitted in any type of intimate contact. HPV is most common among people in their late teens and early 20s. Those who have HPV sometimes don't even know that they have it, and it can pass it on to others.
Most people experience no symptoms from HPV.
There is no cure for the virus. Most times your body will clear the HPV infection on its own. If genital warts develops, the symptoms can be treated.
There is a vaccine that can prevent cancers by HPV and is over 90% effective in preventing HPV-related cancers.
Some people have mild side effects after getting the HPV vaccine. These do not last long and can go away on their own.
Now that you've learned a lot about HPV, you're probably wondering, how can you share this information with your peers? Well, you can get creative. The Protect Me With 3 campaign is a poster and video contest for middle school and high school students. So not only showcase their creative skills, but importantly, increase awareness for the HPV vaccine. Let's check out some previous submissions from past winners.
One important vaccine is the HPV vaccine, also known as the human papillomavirus vaccine. HPV is a group of viruses that can cause infections, genital warts, and even cancers. Every 20 minutes, one person in the U.S. gets cancer caused by HPV, and about 14 million people become infected with HPV each year. The HPV vaccine is the best way to avoid infections and cancers. So, talk to your parents about getting vaccinated because your health is worth a shot.
Okay, so that's basically the video that we created. If you know of anyone who you can share that video to, as well as the schools and the college students. Again, we have one on that focuses just specifically for college students. That would be great. That way we can get the messaging across at this time, especially since we don't have the opportunity to go out and present to the students. We also, Melinda and I are also working on a virtual parent webinar. And we are actually putting together a webinar on adolescent vaccines for parents. It's almost finished. Once that presentation is completed, we will definitely share it with the group. But of course, the purpose of the presentation is to increase awareness about the importance of adolescents' vaccines. And then lastly, for professional education archive webinars, the partnership has a library of professional webinars that are offering professional credits on a variety of health topics. They are also recorded webinars that are on demand. The partnership will also be doing virtual support groups for moms. I've been taking part in those support groups, providing general immunization to the new moms, as well as education about HPV for those who have older children. You can find these webinars on the partnership website. We also have the CU webinar for nurses, Give It Your Best Shot. We actually had a total of 13 nurses that took that webinar last month. So again, you can find these webinars, they're on demand, and you can find them on the partnership website. And lastly, again, please share this information, with your colleagues. If you are working at a school, or, again, share the videos, organization, discuss planning the health fair if you're interested or you have any ideas or suggestions. I just wanted to let you know that I host these calls twice for the quarter. The next call will be in July. So if you are interested in taking part in our education working group call, if you don't have my contact information, please let Emily know, and then I will let you know or send you an email when the next call will be. Okay, that's all I have for now. And now back to Emily for an update on the community education working group. Thank you.
Thanks, Kendra. So I will give an update on our community engagement working group and some of the work that we've been doing since our last meeting in March of this year. We, as many of you know, childhood immunization rates have decreased significantly since the pandemic began. And the New Jersey Health Commissioner shared in her briefing last week that data from NJIAS, our state registry, shows a 40% decline in vaccines in children under 2 and 60% drop in those over 2 years old between March 1st and April 20th when you compare with that same period last year. So, we really see that this is a concern. We want to make sure that parents know that they need to be in touch with their pediatrician to schedule well visits and maintain those vaccine visits so that their children aren't getting behind. If they are getting behind on their vaccines, we need to remind parents that there are catch-up schedules so that they can get caught up when if they've missed any appointments. And also with the tremendous job loss due to the pandemic, there may be families that have lost their health care insurance coverage and may be unaware of the resources available to them, like New Jersey Family Care and Vaccines for Children program, which offers low or no cost vaccines for uninsured or underinsured children under the age of 18. So something that we've done as a coalition has been putting together county vaccine clinic resource lists. We have completed the Essex County list, and we've shared this on our social media. We've shared this on via email, through the EMIC newsletters, and with our community partners to share this information with families so that they know to please be in contact with their pediatrician or a vaccine clinic and to call ahead, make an appointment, and to follow proper safety precautions so that they can keep themselves and their child safe, and we can avoid outbreaks of vaccine preventable disease. We've also been working on some projects to combat vaccine hesitancy. So with funding from the State Department of Health Vaccine Preventable Disease Program, we've been able to engage several EMIC members in a vaccine myths video project, which will address some of the most common vaccine myths and provide information on what the facts are about vaccines, and also some resources on where to find good information online. And we expect that that project will be available for distribution in August for National Immunization Awareness Month. We're also working on a maternal immunization video project to highlight the need for Tdap and flu vaccines during pregnancy. And we're developing graphic videos that will be shared on social media, YouTube, Instagram, Facebook, and Twitter that are about 1 minute in length, and that those videos will be available in English and Spanish. As an update on EMIC membership, we are increasing our social media following. We've seen a significant increase in the last few months on our social media channels. We have now over 300 newsletter subscribers that receive our monthly newsletters, and we are up to 109 active members. So our community engagement working group continues to look at the membership of the coalition and to think of ways to engage new partners and vaccine advocates that maybe are not at the table already. If you're interested in joining the working group, we're happy to have you. We meet once a quarter via phone in between our quarterly meetings, and you can email me if you're interested in joining. I'd also like to share that the partnership's annual meeting will be held on Wednesday, June 10th from 10 a.m. to 11:30 a.m. via GoToWebinar, and Dr. Paul Offit from Children's Hospital of Philadelphia will be presenting on the path to a SARS-CoV-2 vaccine. So to register, all of the information is available on the partnership website. And now I would like to introduce Esme Sharp, the co-chair of the Essex Metro Immunization Coalition and CEO of Bessie May Women and Families Health Center in East Orange, to ask for updates from our EMIC partners.
Good afternoon, everyone. Thank you, Emily. I will first like to just thank Patti and Alicia, if they're still on the line, for such a very informative presentation today. And now we invite our EMIC members to use the chat box feature to provide any updates on their programs or upcoming programs that they are hosting. And Emily, I guess, is going to view the chat box and let us know if there are any updates. We will share these updates with the coalition via the next monthly newsletter. We just would like to thank you all for the important work that you're doing to keep our community healthy and safe in the midst of this public health crisis. And I just want to say, remain safe, proactive, and progressive during this global health crisis to all of our members. Thank you for taking time to be with us today. And I'd like to again invite you to join the coalition if you are not already a member. I'm going to turn it back over to Emily at this time.
Thanks so much, Esme. Again, if you have any updates that you'd like to share right now, you can type them into the chat box. If you have any that you'd like to send following the meeting, you can send to me via email, and I will make sure that it's distributed to the coalition via our monthly newsletters. Thank you so much to everyone for joining us today, and please be safe and be well.